I can remember the first time I walked into the old Mary Bird Perkins and feeling like I shouldn't be there, because I felt like, why did I get this so young? You know, the more that I've been involved with it, the more I realize it's not a young or old person's disease, it's anybody's disease.
When we heard the word, cancer, it was heartbreaking.
It was a whirlwind.
There's nothing that can prepare you for.
At first, I didn't have the confidence. I didn't know that my body would survive it. I think that was kind of my biggest fear was, am I going to come out the other end a healthy person?
When this happens to you, it really puts a detour in your life, and all the dreams and aspirations that you have, all the visions you have of what your life was supposed to be like are instantly altered. And you can't expect anybody to handle that well. It is very, very scary.
One of the hardest parts is telling somebody that they have cancer. And when we tell them, you see the patients go to such a depth that you would hope no one would have to experience. But at the same time, you become their strength. And so they know, they look in your eyes and they know that you're really worried. And I just turn to them and say, it's going to be okay. We're going to make everything okay.
You certainly feel for them and have created a friendship and a bond and a care for them.
Once you've been through the treatment of breast cancer, you're never the same. You're a new person, but how you deal with that is critical. They changed the way they look at life, all because of how they've been treated with breast cancer. I'm a cancer survivor myself. 14 years ago, watching my family go through it, watching my patients go through it, I can tell them, you can do this. And they'll look at me and go, there's no way. And I go, I'm here, I did it, you can do it too.
I really think that a big part of my job is sort of managing fear and expectations, not even just recognizing what's a breast cancer or not. One of the things that we try to do is sort of ground them in the next step. So many women don't think of themselves.
We need to shepherd them through this process. Take care of them like they're our own child.
When a person is faced with their own mortality, or at least think they are, and cancer is one of the words that causes that to happen, they have to take off the layers that they use to cover their soul to get through their normal day. And at that time you can see their light or their fire, and it changes their perspective and how they interact with their family and friends and the rest of the world.
My job is to take away that anxiety as much as I can, to let them know that we have full confidence in our treatment and how we can take care of her problem. It pretty much tells them that there's a chance here that I could go through what sounded to me like a very devastating condition, and having my breast removed, which is, their image of what womanhood is to them, and it could be restored. And in many cases, better than it did preoperatively.
The moment that most impacted me was when my friend that I grew up with and have known since I was 2 years old called me with her diagnosis of breast cancer and said, what should I do? I'm treating her as I would have treated myself, as I would treat my mother, and obviously my best friend. When patients have reconstruction, it reconstructs their whole persona, the way they feel about themselves. They have confidence. They can go into a room and not everyone's going to know that they've had cancer. And when they are a survivor, they don't have to constantly remind themselves or think about it. They just begin living life again.
The life that they have known, it's gone. But what they don't realize at that time is what is before them, although it's scary. Every woman that I've seen go through this, they make this unbelievable transformation. And it's the power of being a woman, it's the power of being a mother and a wife and a caregiver, and to see those women alive and smiling and beautiful on stage. This is not a death sentence. This is not the end by any means.
You don't think you can handle something, and then when it's given to you, you find this courage deep down within that you never knew you had.
It puts life in perspective.
When a patient is in my office, they don't really understand the team approach that occurs to get a patient through cancer treatment. Sometimes the littlest thing you do for somebody is the biggest thing you could do for them.
When you see your patients go through what they go through, the road that they travel from the diagnosis through the treatment, through the recovery with cancer, anytime there are events like this that you can participate in that helps showcase them. They're the celebrity. You know, they're the heroes, and we're just lucky to participate in it.